So we're just sterilising the skin, getting it nice and clean. So this is the masseter muscle. And what we're going to do, we're going to inject 1, 2 and 3. We're not injecting here as this can cause small changes with the risorius. And so by not injecting here, we can actually get a nice treatment outcome without giving her any visual aesthetic problems. So you're just going to see 3 little needles going into here. So what I'm showing you here is the size of the needle. It is a micro needle. And we're just going to use that to deliver our toxin. If I can get you to bite down. That's treatment delivered.